this is the actual words taken from the Down Syndrome Act itself, which really was, and anyone who came to any of our events or looked at some of the resources we put together for that, the Down Syndrome Act is in itself is about the development of and the production of this guidance. That's the substantive aspect of the Down Syndrome Act, is about the guidance, and this is taken from the first section. And there's different duties regarding the guidance. So it's the Secretary of State must give guidance to relevant authorities. We'll talk about that in a second. We'll talk about the second one, relevant authorities must have due regard. Third one, we're relevant for us right now. This, before giving the guidance, the Secretary of State must consult. That's what we're starting now, and there's different stages of consultation. And then some stuff about, basically saying, once the guidance is done, it needs to be published, laid before Parliament, and they can update and revise it as they wish. So it's all, this is all state stuff, processes taken directly from the Act, and very much the whole purpose of the Act was about the development of this guidance. So in terms of a couple of the key references in the Act about relevant authorities and relevant functions, and these are reflected in the call for evidence. Certainly the relevant authorities are. So the relevant authorities that were identified, National Health Service, social care, housing, education, and youth offending. And if you want to look in a bit more detail about this, we've got, we did a legal event about the Act. There's a video online, and we have a legal briefing as well, which goes into this stuff in a bit more detail. And there's one of the big issues that comes up with any kind of statutory guidance is about the weight or the strength that it has, and the phrase of due regard. And this is, again, we discussed this quite a lot when we were looking at the wording of the Act. And basically, again, if you're interested, I'd recommend our legal briefing on that. But basically, the due regard is local. These relevant authorities need to take it into account when they're making decisions, but it's not a cast iron legal duty that X has to happen. And so it's a bit of a, there's a lot of gray areas about how statutory guidance then needs to be followed, and how rigidly it needs to be followed. And that's something which we hope will come up further during the process of the call for evidence and the later consultations. And then obviously once the guidance is released, that's a key issue. So the process as it stands is, so the Down Syndrome Act got royal assent in April. We've just, the call for evidence, the second stage just started for 16 weeks. So that will take us up to early November. Then the DHSC will take away all the information and all the evidence that they get and draft some guidance. And that could, and there's no timelines beyond the call for evidence, because it really just depends on what else is happening in government and how much information that the DHSC have to go through. I mean, the other complication they'll have with this is because it covers things like health, education, there'll be housing, there will be liaising with other government departments, which it might add a bit more time in terms of drafting. But at some point, draft guidance will be developed, which will then go out for a second public consultation, which again could be anything from 12 to 16 weeks. So, at this stage, we've got this call for evidence is a fairly broad set of questions, which people are free to kind of put all kinds of things into. The next public consultation will literally be, here is a draft bit of guidance, and the questions will be based on that guidance and about, looking at, we disagree with, chapter 2's focus or whatever. So the second consultation will be much more focused on the actual statutory guidance itself. Then DHSC will then take away all the evidence from that consultation, and they will then at some point publish the final version of the guidance. According to the call for evidence in the introduction by Gillian Keegan, she says it should be ready next year, but I think it could be, possibly, it's hard to say, but it will be, possibly middle or towards the end of 2023, realistically, going through all these different stages. So it'll be some time before people can start using the guidance itself in terms of, supporting themselves or family members. So the call for evidence process, It's a series of questions covering, and again, it reflects the Down Syndrome Act. The questions cover health services, adult social care. Well, it's a slight difference, we'll talk about in a second, housing, and then education, children's social care. And one of the caveats in this call for evidence is, and this was something we were talking about during the legal events when we were looking at the Down Syndrome Act and the wording, is that the Act doesn't require any additional rights or provisions for people with Down syndrome. Therefore, it's about it needs to reflect the other laws and statutory guidances within all those areas of health, social care, housing, etc. Many of you will be aware we're going through a very busy time in terms of education and children and young people. There's the SEND reforms, which the consultation on the green paper, the SEND review, has just concluded. So again, we're a long way from the conclusion of that. So we're at the first stage of the SEND review, where DFE, so it's Department for Education, had led that one. They now have lots of information about the SEND review paper, and they're going to have to go away and come up with some recommendations, or government will have to come up with some very specific recommendations where things go. And therefore, the Down Syndrome Act guidance will absolutely have to reflect the education, and the children's section will have to reflect those wider reforms that are happening within special needs. And we knew this, but obviously it's because, and we knew, things like the Health and Care Act would be reflected in terms of the health services bit, but because the special needs stuff we're still a long way from concluding that. That's why there's this caveat that the questions they're asking in the education, children's social care are not as broad. There's not as many questions, and the social care is similar. That some of you may be aware, there was an independent review of children's social care which has recently concluded, and again, government are looking at that in terms of where they go with the recommendations. So it sort of reflects, what we were sort of expecting that, and I think as we go into the future, the guidance will always have to reflect those other laws and reforms that are taking place within the areas that it covers. It's not in itself a whole new set of regulations or duties around for people with Down syndrome. And then there's also a question. So these were the areas that were in the Act, but there's also a question where they're keen to ask whether, or hear the views about whether the guidance should cover wider public services. So, for example, a lot of people are already looking at things like employment. Should there be something in there about employment, for example? But it's a question that's left very open. So I think that will be one of the things we'll pick up during the actual consultation when we speak to our members and our groups. And the deadline's 8th of November, 11:45. So about 16 weeks. So quite a good chunk of time, but it is over the summer, which isn't always the best time for consultations. So who's it aimed at? I mean, really, government do a lot of these consultations. So as I said, we've had a big SEND review one, but there's often very little consultations about very specific bits of law or guidance. And there's always a very clear focus that, that they're very keen to hear as many views as possible. And we've certainly heard this from the team at the DHSC, Department of Health and Social Care. They're really keen to hear a really broad selection of experiences and opinions and evidence. In terms of the paperwork, it's very it separates the questions out into people who have specific questions for people who have Down syndrome, their families and carers, professionals who work with people who have Down syndrome, and then people with other genetic conditions, including learning disabilities. And that comes from something. So during the journey of the Act, when it was a bill during Parliament, there's a lot of questions about, and I'm sure some of you will be aware of this, why was it just about Down syndrome? How is it going to affect other people with learning disabilities or other children with special needs? And so during the passage in Parliament, it was very clear that the consultation processes, would it reach out and engage with other groups and other relevant groups, such as people with other genetic conditions. So that's an important thing that's highlighted throughout the call for evidence. Right. How to respond? There's different options. I mean, these days now, Well, first of all, yeah, have a look at all the documentation is on the website, including an easy read version. They list all the questions, and there are, as I said, there's different sets of questions that, well, it's the same focus of the questions, but they're still worded slightly differently for some of the different groups. But it's all available online before you, before you sort of click into a survey. So do have a look at the paperwork, and then you can respond either as an individual, you can respond on behalf of someone, or you can respond on behalf of an organization or a network. And you can do that. The most common one is usually the online survey, which is there on the actual the call for evidence page. If you have more to say, or if you have problems with the survey, you can send document, a document version of your response by email, or you can print it out and send it by post. And all that information is in the paperwork in terms of how you do this, but we've got some of this stuff up on our resources. We've done an FAQ on this. So there's, if you've got any questions about these particular process type issues, then have a look at the guidance, or just get in touch with us and flag it up. So other considerations. So that's it. I mean, it's a really, the Down Syndrome Act is a as pieces of legislation go, is a fairly straightforward act, and I think this consultation reflects that. So again, I think the challenge with all these, as always with any consultation, is making sure that our responses reflect what's happening at the moment, what reflects people's experiences, and actually contribute to something that can make a difference and can actually be something incredibly positive and useful. But just some other considerations to think about as we go through this call for evidence and beyond. That issue I raised earlier about accountability and redress, due regard is a useful requirement for local authorities or health services, but is there something as we go forward that as we found with many issues in consultations, and you might have seen in the SEND review, accountability is a really big issue within the system in terms of people getting what they're entitled to. So I think that's a question that will stay with us as we progress. That issue about the scope of the guidance, it's up to the Secretary of State can make the guidance broader than the Act. So what is it? What are those other issues outside of, education, social care, housing? These are pretty big issues, but are there other ones that we might want to suggest are included? I mean, just to point out also the third bullet point about this is a process to get as much information as possible. It doesn't, there's no guarantee, even if lots of people say the same kinds of things, it's no guarantee that all these things will be included in the guidance. As I said, one of the big considerations with this guidance is that it reflects the law across all those other duties. So that's, and that's that balance where we want to be aspirational with this guidance. We want it to be doing as much as it can, but it still has to operate within the framework of statutory guidance and legislation that currently exists. We've spoken about the other engaging out with other groups, and we'll certainly at the DSA will be looking to reach out with some of the other networks of organizations of other disabilities and other genetic conditions. And the last point I've made already. So very quickly, Down Syndrome Association will be our first priority. Was doing what we've been doing today and for the last week, is about supporting members and partners understand the process. So last week we did a blog. We've just released some FAQs. We've been responding to individual inquiries, and we're doing today's events so that people understand the process. We will very soon start looking at a range of consultation events and surveys, and a bit of a balance between some of those, doing some events by theme, so getting people who are interested in education or health or whatever together, but also looking at specific groups, so groups of young people, groups of parents, groups of adults with Down syndrome. There's all kinds of groups we can bring together as well, about bringing in their perspectives. We'll be sharing any news and updates as the call for evidence goes on. As we said, we've been engaging with the team at the DHSC behind this for some time, and we'll be looking to share any messages that come out from them, and we'll be engaging with them directly about the consultation. And they've committed to coming to some. Well, they'll be engaging with the call for evidence themselves, so we'll be looking at that. And then we'll be looking at working with partners and networks around, again, how we can influence the call for evidence, and how we can get as good a response as possible. Next steps. This kind of bit goes back to the timelines. They'll, the department will analyze the evidence. It will inform the development of the next stage, which is the actual draft of the guidance. DHSC will publish their progress on this in due course. That's from the overview of the call for evidence, and then the draft guidance will go out to public consultation. And just to highlight one of this is taken from the this bottom quote is taken from the paperwork in the call for evidence. It just gives a sort of a direction of where things are going. The call for evidence will ensure that the guidance is evidence-based and reflects what people with Down syndrome, their families and carers and professionals tell us is important. So it's that balance of experience but evidence. So again, we'll be looking at, there's a lot of good evidence from research, from practitioners about good practice, and that's a chunk of really important stuff to include. And then there's the evidence directly from people with Down syndrome and their families about what has worked for them, what has been really useful, what they would like to see more of. So it's about sort of bringing those two sides of things together. So here it is, and we'll send all this around later. There's the call for evidence website. You can email us on this, and we've got a whole section on our website. We've got a whole section on the Down Syndrome Act, which has got some of the legal stuff we spoke about earlier, but also we've got increasing amount of bits and pieces coming up now about this specific call for evidence.